Now, that's an example. So I know clearly normal, abnormal. But then if it's normal, here's an example. So if it's abnormal, then suddenly I have, overgrowth pathogens and stuff like that. If it's normal, we also know that bile acids to some degree can be a little bit toxic, right? So it's not it's again this balance between health and disease, right? So once you know it's normal, then you could potentially, manipulate bile acids a little bit better. So you couldn't change them drastically, but there are some bacteria, for example, that can convert the bile acid in some of the iso-oxo, this new bile acid forms now, and then suddenly maybe you replace your secondary bile acids with less toxic ones.
To the Pet Food Science podcast, and we have the great privilege today, and really I'm excited about this opportunity to interview Dr. Jan Suchodolski. We've talked a number of times, so we get to talk again, and Dr. Suchodolski is a expert in the microbiota of pets, and I don't know if you know, but my perspective is that this is one of the areas where much can be learned, and where this is a very fertile ground for new information and new paradigms of nutrition. And so I'm really excited about having this conversation. I wonder if you could tell me a little bit about your background, how you got there to Texas, and what you find today.
Yeah. So my name is Jan Suchodolski, and I did my veterinary school in Vienna, Austria. And I was there for a few years in private practice. And then I always wanted to do some research experience. And so the opportunity arose many years ago, almost like more than 20 years now, to come to Texas A&M and to the GI laboratory. So it's a special lab that really focuses on understanding GI disease and mostly focusing on developing biomarkers. So it's kind of a diagnostic lab, but also like an academic research lab. And I started to work a little bit on, developing diagnostic markers for GI disease. And then I liked it so much, so I stayed on. And one of my PhD projects started to be back then to better describe GI diseases related to dysbiosis. So back then, the disease was called small intestinal bacterial overgrowth. And the goal was to kind of better identify that. When I started, it was still culture time. So my first year of my PhD, I still did bacterial culture. And then the very first papers came out showing with molecular tools that, there's so many other bacteria there that back then we never even knew about, right? And so I kind of switched my PhD in being descriptive, trying to develop those tools and better describe who is there, and mostly in the context of GI disease, I think. So that's why the perspective that I usually come from is the perspective of GI disease. And over the last 20 years, we know very, very well that diet, nutrition, is one of the best, medications, right, especially for chronic and acute GI disease. And the interplay between the GI tract, absorption, nutrients, the microbiome is quite complex, but it allows us to really see from both sides, pure nutrition, healthy animals, all the way to the perspective once you truly have already abnormal GI tract function, and then how to treat this gut and so on. So that's my background.
84 million times a day, pets eat meals with ingredients from Trow Nutrition. We bring together the science of ingredients, nutrition, and blending to unleash possibilities for pet food brands. Premixes are just the start. Turn to Trow for higher inclusion ingredients too, like proteins and carbohydrates, and highly sensitive ingredients like probiotics. With our palatants and base blends, you can feel confident about what comes in our bags and goes in yours. Learn more at TrowNutritionPets.com.
Well, it's a fascinating one. What do you think? I mean, I'd sort of forgotten you actually started before the molecular tools hit. That window that opened up with the molecular tools, what was your thought at the time? I mean, for me, it was just fantastic, but you were right there. What were you thinking?
Well, I was thinking that was very exciting, and and I thought it was actually challenging because nobody could help you right away. So all of those tools were very, very new. And actually, I studied before molecular. I studied with those big gels. I don't know, maybe some people don't even know about them anymore. Those the nature ingredient gel electrophoresis. So it took me 6 months to have my first banding pattern and so on. And I mean, it was very beginning, so I must say, but it helped me a lot to also focus on the details, but also discover that often you have to really keep in mind the big picture. And I think that is nice because it really helped me to frame, right? That small things when you see them. So we started with clone libraries. I went through every sequence manually and like checked every single little peak if it's correct. In the end, later when we started doing sequencing, I discovered, it doesn't really change that much the overall picture, if that makes sense. And I think that is really what I try to probably emphasize also today is that we need to look at both the big picture and the small picture. And then especially also looking at, shifts that happen in health, but also shifts that happen in GI disease. So this is the perspective that really drove me. And I think, in the beginning, we were very simple thinking, right? We thought once we identify, I can even tell you my PhD was to prove how well antibiotics do because, we see this clinical response to antibiotics. So the ultimate goal was, well, let's see how antibiotics shift the microbiome. And then we can maybe recreate the same shifts with nutrition, with probiotics and so on. And, then I saw, whoops, actually antibiotics do everything worse objectively, but they stop diarrhea, right? So it was kind of this whole frame. How do you combine all of this that in the end you see shifts that don't always correlate with the clinical picture, right? But so it was kind of starting everything new, also going against paradigm shifts and so on, and, observing data. And for me, what I always say to my students nowadays, the data never lies. The data is the data. But our interpretation of the data truly changed, and it changed really drastic in the last 20 years.
Yeah, I was prepared to talk the other day, and I was thinking, I want to tell the audience that the data are still right, but at least 10% of what I'm telling you is wrong. I just don't know what 10% is.
Exactly. Yes.
Well, you've traveled that. Let's talk a little bit about that health versus illness in the microbiota. One of the things that just strikes me is how diverse health can look, and yet lots of times illness. And you see that dysbiosis and you go, whoa, I understand that pet's sick. But what do you see when you look at it from your side and the depth you understand?
Yeah, so and again, that's the beauty of the long journey, right? You see different things. And so we always came from the disease side. Okay? That was always our goal. And so that's why for me, we always saw those differences between health and disease, but they were overlapping, correct? So there was this, clearly there were some dogs and cats that were clearly far away and other ones were overlapping, right? But when you start a new field, you kind of always, describe it statistically, right? So you always say, there were differences between healthy and dogs with chronic GI disease, right? And then you discover, wow, after a while, everybody repeats that, right? And everybody thinks there are actually differences chronic in dysbiosis. But actually with time, you discover that it's not true, right? So that some clearly abnormal and some have a complete normal microbiome because it clusters always with health, right? And so you come from the medical field too. Ultimately, what we need to do is we need to put this all in a perspective of reference intervals. What is, the huge range of normal, if that makes sense. Because if you always describe something in a small population, healthy versus diseased, you're always going to find statistical differences. The question is, are they meaningful for every single animal or not? So what we discovered in dysbiosis now is that dysbiosis is actually almost the microbiome is, and that's really I want to highlight too, is the microbiome is not independent of the rest of the GI tract. I think that's a little bit the challenge that very often we get lost in the microbiome, but forget that it's really parts of the GI tract and it responds what also happens in the GI tract independent of nutrition. So the way I describe it very simple is, if you look outside, you see your beautiful ecosystem, right? You see the trees, all the different variety and so on, but it's still going to depend very much on the soil, right? Other components, not just the nutrients that come to it. And so the concept what we're developing over time now is that actually dysbiosis is the reaction in most cases, and medically you need to distinguish them a little bit. But in the end, there's probably 3 or 4 different areas. We can clearly see shift in the microbiome, but it really depends what was the cause of the shift. Antibiotic is like burning down the forest, right? But the soil is still actually very fertile. So usually either it can grow back, or if you know now to do the perfect modulation, the most fecal transplantation, we can bring the microbiome back, right? But then you see dysbiosis coming when it's chronic inflammation. The inflammation is a process that has been there for many months to years. And when you look at the histology of the GI tract, you see, villus atrophy, the transporters are decreasing and things like that. So the function of the gut is completely different, right? And that's what we're discovering now. It's a chronic process. It's also something that changes over time. And that causes going to be, again, shifts in the microbiome through various mechanisms, low-level malabsorption on the mucosal level. You have a little nutrients that get absorbed. You have a little bit of inflammation, oxygen. It's many different things that happen, And this dysbiosis pattern is usually not reversible anymore, right? If that makes sense.
Could you say that again? Do you say usually not reversible?
It's not reversible because it is, again, the response to the chronic changes on the mucosal level and GI tract.
So if you went in and changed that inflammation, say, for example, you cured the disease and those villi start growing back, do you still have the dysbiosis that sort of...
No, then actually it should reverse back. And it should reverse back.
Yeah,
exactly. But what I'm thinking is, what I'm just trying to say is, when you look at GI disease, right, and we take biopsies, and at the moment everybody focuses on the inflammatory component. But inflammation, there's a reason why inflammation is there, right? It's this low-level inflammation that over time leads to remodeling of the mucosal structure, right? If that makes sense. So you have shortening of villi and so on. And that's exactly where you hit the spot. If you detect it early, it may be reversible, or maybe enough regeneration that the function keeps, stable, right? But if you pass the point, then it's not going to be. Then it's a management tool, right? So we're discovering now that you have, like in kidney disease, you're an expert in kidney disease, right? In the gut is the same principle. If you don't detect it early, those changes are subclinical for a long, long, long time. And once it becomes clinical, usually that's when the system broke, if that makes sense, right? The system...
Well, it makes lots of sense, yeah.
Exactly. So I think we need to also really, really discover the staging system in the GI tract, exactly like for kidney disease, right? And that's something we don't have, right? Diarrhea stops, everybody thinks, wow, everything is normal. But now we're discovering it's not. And that's why we discovered that dysbiosis is, again, it's both. It's a marker, it's a sentinel, right? If the gut environment changes, then you kill things off. But obviously, once it becomes abnormal, it contributes again, right? It's not one or the other. It's a complex system, like our ecosystem. And that is, I think, the biggest, probably, the biggest, one way exciting area that we discovered the last few years, because it allows us a different approach, right? It's not like this big black box anymore. It allows us to distinguish, is the gut functioning properly? Then we probably have a huge range of a normal microbiome, right? That means there I can modulate it easier. But think about it, once the GI tract is not functioning anymore, and the dysbiosis, that's almost like the trees of data. That's what I would say, right? And then it's a very different kind of modulation, right? If I can modulate at all, right? So that's kind of the big areas that it's important to always put the microbiome back into the environment.
Sure. Well, it's fascinating. And it's really such a broad view, isn't it? It's that encompassing the microbiota in the environment that it's living in the pet. And so I think I have suffered, when I first started, I ignored the microbiome. It's like, who cares? It's going through the gut. I can't measure it. I didn't have your skills even in the culture days, and we'd give up fast. And then sort of became all available, and you sort of get this idea that, wow, if I just could control the microbiome, I could control it all. But what you're telling me is, oh, no, it's more complex than that. And I find that very complex.
Yeah, but it's also like, we forget how many bacteria are present, right?
Talk about that a minute.
Feeling,
just
right?
help us understand. Like when I started, maybe we had 20 or 30, now you might have that many phyla, right? So tell me what you've got. I want to know.
Okay, so I think the first question is the sheer number of bacteria, right? And I think a lot of clinicians for sure, and also probably, when we always do the same thing, we don't get the feeling is, but, well, nobody really knows the right number. Some people say it's 100 trillion, somebody say it's 1 trillion, or 10 trillion. But if you just think about the number of trillions, right? What is actually a trillion? I don't think we have the feeling what that means. And as this really nice example is that if you have 1 million seconds, right? 1 million seconds, how many days are those?
I have to do the calculation. Tell me. It's 11 out the calculator.
Yeah. It's 11 days, okay? It's 11 days. So when you go to 1 billion seconds, how many years are those? How many days are those with you? Just, it's you're going up, right?
Yeah, you got the 1,000, right? So a million. So you've got 11,000 days.
Yeah,
So
so
you
it's
divide
31
by
years. I
3.
can tell you it's
Yeah.
Yeah, it's like 31 years, right? And when you go to 1 trillion, it's 31,000 years, right? So I think, it's, in our head, we don't really understand how much 1 trillion bacteria is. So, and then you say it's 150, who cares? It's a huge number. So changing this system is not easy when you think about it, right? And so that's number one, right?
Can we stay there for a minute? So does this system then become so robust that it sort of controls its own environment? You come in what do you mean when you say changing the system is so hard?
Well, changing the system it's a dynamic system. But again, for me, it helps me a lot. I'm lucky living in Texas with 5 acres of land, right? So I can really observe this huge, it's all together, right? So that's the way I see the microbiome. It's dynamic, it changes, right? The question is, there's probably a huge range of normal, right? And within this normal, it can change, right? In the spring, it's going to look a little bit different because you have all the flowers, right? In the fall, summer, in Texas, we have the heat, right? So you're getting at the edge of, it's stressed out the system, right? The rain starts in the fall, but, it recovers quickly again. You have a few, this year we have a few trees that died. But overall, I think the system is robust enough, to move on. That's the way I see it. But again, it's still important that the soil is good. You have the right amount of water, you have the right amount of sun, and not too much, not too little, right? I mean, it's a balance, right? Biologically, it makes perfect sense. And the same way I see the microbiome inside of us. It's a dynamic system, right? But it's still a huge range of normal, is that I would say. And then, if you're on the left or right side, that could be today a coincidence, right? It could be spring versus fall, but it's still the same system, if that makes sense. But that's what diet is for me. And the second thing is for me, and maybe I'm sometimes a little bit not clear or specific in my language, okay? So for me, diet is a very important part of the microbiome substrate, no doubt about it. But what I try always to say is diet is not going to change the system dramatically that it's suddenly trees grow, if that makes sense. You know what I'm saying?
So it makes sense.
So yeah, I compare this. When I fertilize my tomato plants, I get beautiful tomatoes, right? But my 5 acres not going to change that much, right? So that's we need to put this in perspective. That's why I think it's so important to keep the small, the detailed picture in place, but not the big picture, right? If the system shifts, something major happens. That diet cannot do that, right? Or shouldn't do that, or something like that. And I think that's over time, we see those dietary changes, right? But that's why it's so important that we really also understand, is this dietary change really a major shift, or is it kind of within this normal range? And so think about this. I mean, how many things change blood glucose? Many things, right? But do you really care? In most cases, no, because you know where the reference interval is, right? And you know where the cutoffs are, and then you say, well, even if it goes over the cutoff for temporarily, it's not going to be a problem. And so we need to do the same in the GI tract for the microbiome. It's and people always say we cannot do that. And I kind of very push back against that, because we can do it like any other organ system. We can define clearly where abnormal is, right? And then once you accept this, then you can, within normal, like liver or kidney disease, right? Then it becomes in a very difficult sentence.
I mean, that's a fascinating idea, because on one hand, I remember once I brought into a coworker, I said, here's a microbiome system. And he said, well, that one's really clearly dysbiotic. And I said, well, of course, that pet had died, So yeah, exactly. We can recognize death when we see it. But it's that idea of describing it in a way that has meaning. And that to me is really where your work is going to be, or maybe already is. That's what I'd like to hear from you. So you can say, okay, if you're kidney disease and you say, I've got these markers, I like SDMA and creatinine and BUN, and if they're all going up, we've got renal disease. And if maybe at this level, we've got iris stage, I like the iris staging, 1, 2, 3. Do you think that's possible with the microbiota? Is that your goal?
Yes, absolutely. I think it's possible. Exactly. If we accept, it's a new field and everybody wants to describe everything at the same time, right? If you accept the same system like kidney and liver, yes, we can do that, okay? Because we have already now, when you look at the dysbiosis index, and we just published this one paper, what we did is...
Fascinating paper. by the way. Fascinating.
But this is exactly what we need to do is, not just looking at small, dogs before and after diet and so on. You need to put a huge number of animals in the same run, right? With different conditions. And then you can suddenly discover, yes, look at that. That's where the huge range of normal is, right? And if some dogs go to 1, 2, and from time to time one is at 2.5, that's still maybe a range, but the majority is going to be below 0, right? And if you have dogs that are 4, 5, 7, 8, 9, right? They are way out there. And the second thing is that's all upcoming because all those papers are there is, for example, we also run paraclinical trials, right? It's not just that this is a descriptive study. We know already from other data sets. Once you are a 4, 5, 8, 9, even fecal transplant doesn't bring you back anymore, right? Because that means it's a very severe dysbiosis, but the reason is dysbiosis has to have a reason, right? And so we have data that if you have antibiotic-induced dysbiosis, I can bring you back with fecal transplants. If you have chronic GI disease, I can bring you back temporarily, but usually dysbiosis comes back again. And again, that comes for me this equivalent. If the soil is broken, you can try to plant whatever you want, right? And if the soil is broken even more, like a Sahara, it's not going to even grow for like 1 or 2 days. And I think this size effect that I think is crucial. So a size effect is to see, how much something shifts. And if something, like you said before, if those specific markers shift, then something are clearly becoming abnormal. And then once you accept this, then it's easier to afterwards go back to the huge range of normal and says, okay, now maybe with this normal, I can still optimize the system. There's nothing against that, right? It's just you're going away from this, putting everything into one big bucket, if that makes sense.
Yeah. No, I'm following you, and then optimization becomes that which is possible, right? Maybe using your analogy, which I've totally glommed onto, if you're at the same time trying to fertilize and trying to improve the soil, your optimization is totally different than if the soil is completely robust and the sun shines and the rain comes every week.
Yeah, absolutely. Yeah. So I think I learned a lot from just observing, and I think that it's why would the gut be different than any biological, ecosystem on the planet, right? I mean, we are still on the same planet. That's why I think we can learn a lot from those. And I think for me, it's important that small details can be important, but we need to understand, are we focusing on the small details? Then we need to also have more biological functioning done, right? And for me, nutrition is absolutely crucial, right? It's digestibility, it's like beans, and it's a combination of, if you can change the system, improve with different nutrients, each of them makes a little shift combined, then you can make a stable microbiome, right? That makes sense.
So we've looked a lot, nutritionists in general, and I personally, we've looked a lot at trying to feed the microbiota, to get some bypass carbohydrate down there to, they obviously need nitrogen too, and even trying to manipulate that with sort of gut released phytochemicals and, in ways using the nutrition we have in our hands to influence the microbes. But I wonder what your perspective is. Do you see, your favorite, if you will, your favorite way of manipulating the microbiota with nutrition, or are you there?
No, I'm there, but I mean, again, that's something I want to just very highlight. I'm kind of from the disease side, so I'm not a classical nutritionist. So that's why I like to work with you guys, because you can afterwards optimize it. For me, is focusing on the markers that I believe are clearly associated with health or disease or indicate something that makes sense. And I'll give you an example. Now, Clostridium difficile is a very important pathogen in human medicine, right? And in veterinary medicine, it's a beautiful example because every textbook says, well, we don't really know, it could be, it couldn't be, whatever it is, right? It's always like, nobody's clear. That means clinicians, when the dog has diarrhea, they run a pathogen panel, they see it's positive, they're going to say, well, be on the safe side, let's treat with antibiotics. As an example, right? What we have beautifully discovered now is that exactly like in humans, Clostridium difficile is closely regulated via bile acids, okay? So we have this conversion of primary to secondary bile acids, okay? And that's just been very beautifully established in human medicine. And now we see the same thing in dogs, right? If you have the presence of Clostridium difficile, in 90% of cases, you also have dysbiosis and you have a lack of bile acid converting bacteria, right? You have this beautiful association. So that's what I'm saying. So,
and the pet has a component of that, right? Too. I mean, that's a trans talk with the host there with those bile acids, right?
Exactly. Yeah, that's what I'm saying. So, what I'm saying, you're focusing on very conserved pathways, right? So, for me, bile acids is almost a highly conserved pathway, like creatinine. Does that make sense? And actually, you can really, really well describe, what the reference interval is. That's very consistent. Okay. Now, that's an example. So I know clearly normal, abnormal. But then with normal, here's an example. So if it's abnormal, then suddenly I have, overgrowth pathogens and stuff like that. If it's normal, we also know that bile acids to some degree can be a little bit toxic, right? So it's not that it's again this balance between health and disease, right? So once you know it's normal, then you could potentially, manipulate bile acids a little bit better. So you couldn't change them drastically. But there are some bacteria, for example, that can convert the bile acid in some of the iso-oxo, this new bile acid forms now. And then suddenly maybe you replace your secondary bile acids with less toxic ones. Does it make sense? So for me, it's this crucial understanding, are you clearly abnormal? It's a different reason why you're abnormal. But if you're normal in health, I can take those components, right? And then maybe better engineer to have less a little bit toxic effects. So like proteins, right? This putrefaction, So it's maintaining health, and that's probably the most important thing, because that's also my ultimate goal. You know why? Because we know now, if you detect GI disease, if you detect dysbiosis, or at least increased dysbiosis index, right? So that's a marker. Then it's usually too late. If I can explore antibiotic usage, it's almost too late, right? And so my goal is, with the future, is really to decide, hey, we need to have nutrition, we need intervention, we need to make the microbiome stable. Like how many veterinarians, diarrhea, short episode of diarrhea. Owner girl comes to the vet and we give metroranazole, right? So it's an indirect consequence. But I'm saying, if we can, with diet, with fiber, prevent those episodes where the owner is, oh my God, my dog has diarrhea now, and I don't take my dogs because I could diarrhea to the vets, because it's self-limiting. But many owners, for them, it's important, right? And then suddenly it becomes this cascade, that sometimes we have a little bit to overtreat. So my point is, there's plenty of things to do in nutrition. We can keep it all stable, and so on. But we need to just accept the fact, right? We are dealing with a healthy gut, and we can optimize it, right? But we can probably only optimize, we're going to have to 4 or 5 screws. It's not going to be one magic screw, if that makes sense, right? And I think so it's a multimodal approach. And once you do that, and we see animals, for example, that are extremely stable in this dysbiosis index. You could measure them. We have a cat, for example, it's our fecal donor cat. We have it for 2 years. This cat is almost exactly the same number. It's like incredible, right? And then with other animals, they jump within normal, right? There's a huge variety. So that's also the question, why on some diets, some animals keep it very stable and other ones not. So keeping something stable is probably a good way, because the less you have perturbations, right, the less little chances of little episode of diarrhea and things like that.
Let's delve into that a little bit, because I think there's some discussion, right? In some hands, we back to the human analogy, but you find if you keep that young child in a very, very sterile environment, they're more likely to have asthma when they grow up. There's some, and I think that's generally accepted. I believe it to be true. And there's some sort of idea, even on a nutrition side, that maybe some changes over time would be valuable, and let that gut kind of find its own, swinging normal in and out. What do you think?
No, I agree. I think variety is important, but I'm just saying, maybe to special. What I'm saying is, like, for example, with animals that like cats, right? This cat, for example, is, good question, although, yeah. Well, I think we're probably talking about 2 different things here. One is, allowing him to be exposed to that many different things, correct?
Right. That's what I'm thinking. The cat may have some benefit of being out on those 5 acres, hunting a little bit and feeding my good diet the rest of the time, of course.
Well, yes and no. It's a philosophical question, because I think of my dogs. My dogs, we have 5 acres, we have chicken, we have they roam around, and from time to time, they have diarrhea, and sometimes it's bloody diarrhea. And last time that blood diarrhea, they had salmonella infection, right? But so my point of that is, the question is, maybe take it back a little bit. So when it comes to GI disease, right? And I think nutrition is supposed to prevent try to prevent disease.
Optimize health, anyway, we always say.
Exactly, yeah. And so I think maybe it's important to also highlight that we're pretty sure that GI disease is also, in many cases, like a little damage model, right? I think damage model means so in human medicine, for example, acute gastroenteritis. Okay. So an acute gastroenteritis where you are 2 days in the bathroom and then you forget about it, you laugh it off, and then a few months later, you have start becoming chronic GI sites. Okay. And the reason for that is simple things like, molecular mimicking, so the toxins of E. coli that you cannot prevent really because they're everywhere, right? They suddenly, your immune system cross-reacts with them. Or maybe you had little scar tissue, like look at your skin. How much scar tissue do we have on our skin?
I don't want to talk about it.
Exactly. But in the gut, it's probably the same thing, right? But then in the gut, there could be some motility changes, bacteria attach, and so on and so on. So we know, for example, now from 2 studies, parvovirosis, roughly 40 to 50% of all dogs that survive parvovirosis are going to have an increased risk for GI disease later on. Okay? Same thing with dogs with acute hemorrhagic diarrhea syndrome, right? Also 27% of them have it, right? Now we also know antibiotics. There's a new study from Greece came out looking at kittens. So when kittens receive antibiotics early in life, they were more likely to have diarrhea. So my point of that is variety is good to be exposed, but the risk is always there. It's almost impossible to prevent, because that's what life is about, right?
Yeah. And it's probably, it's part of life. Why should we get too hard?
Exactly. But I'm saying but I think those are sometimes the simple explanations why GI disease happens late in life. It makes sense. It's in most cases damage model. And then you have genetic susceptibility, on top of that. But even in humans, genetics plays a minor role compared to, something else. And so I'm saying is that so what I said before is it's good to have diet variety, allergies, and so on. But ideally, you have a microbiome that's stable, right, to prevent those little exposures to gastroenteritis, which is self-limiting. Doesn't have to be treated, because it goes away, but it can those little micro damages that potentially could be a risk factor, for the future.
I get it. So if I could summarize what you're saying you want a quality diet and you want that all the time, and you want a diet that benefits the microbiota, and that probably means for you some carbohydrate that's coming into the lower gut, and anything else. I mean, what else might? As I'm a nutritionist, I want to feed that microbiota as well as the pet. That's the late in life revelation. What do I do?
Yeah, no, I think when you start thinking about also the core microbiome, and I think there's also like a lot of discussion, what is a core microbiome and so on. So for me, a core microbiome makes sense because every biological system is going to have specific functions. That's probably going to define the majority, right? And so we know that the core microbiome are bacteria like Clostridium, right, who converts bile acids. And we have other like Fecalibacterium, very well established from human medicine, right? That's a bacterium that does endophilic components. Many of them respond to fiber, right? So that's why fiber is a good one, right? Here, maybe you could later, modulate it. Maybe that's why you say, okay, dogs with low Fecalibacterium, maybe they need a little more fiber. Those are the small things we can figure out in the future, right? But the principle is they're very now, I think, established pathways, of functions. And maybe, some bacteria are clearly linked to a function. Some other functions, many bacteria can do, if that makes sense. But we need to identify those important functions like short-chain fatty acids. Also, I think too much is probably not good either. It's the balance, right? If that makes sense. And so that's why you optimize this. And realistically, we cannot make a magic out of nowhere, right? But I think maybe that's where the precision medicine is going to come in, Those dogs respond a little bit better to this protein, That's where maybe the future is. But the realistic approach is that that in the end, it's probably not being a big magic, right? It's the right protein source, it's the right fiber source, and so on. And maybe that's where a little bit variance comes. Not every animal is going to respond to the same fiber. So fiber blends makes perfect sense to me, and things like that, right?
Yeah. Oh, that's great, and I think very clear insight. I wonder if we could talk about a couple other things. This is fascinating to me. Thank you for sort of showing it to us. But you've talked kind of about the probiotics and then this term, I don't know if you use it as much, but I sure do, the postbiotics. You said, well, of course, if you have too much volatile fatty acids, you have diarrhea. Right? I mean, that's just clear. You can go over the top, but I sort of like butyrate, So I wonder if you could talk about kind of both ends of the microbiome, what we might do. We kind of talked about feeding, but what we might do with probiotics to establish it, and maybe what are those postbiotic markers that you might be following in this desire to get optimized nutrition.
Yeah. No. So I mean, it's pretty much a follow up what I just said before, right? That there are certain pathways, kind of that we know they're important, and that's why they cross-react with the immune system or prevent pathogens, right? And so if we be able to optimize them better, that they are not on the bad side in this right range, I think that's probably the biggest rewards for the investment, if that makes sense, because that makes sense. And so again, it's again the short-chain fatty acids, it's against the bile acids. The bile acids are a very regulated pathway, but there's many different new isoforms that we identified that potentially could be a little bit of less toxic and so on. And then the probiotics, obviously. And the probiotics, again, it's always about expectation, right? We need to understand a probiotic can do only limited amounts in the guts, right? It's just a fact. I mean, because think about, again, if you have trillions of bacteria and you're giving, some billions, it's still a very small amount and so on. And so again, that's why it's so crucial to understand, is this probiotic doing a clear immune stimulation? Does it attach to the small intestine? Can it help with some of those pathways, right? With digestional items. So we need to be really very clear. For me, focusing sometimes on the big pathway probably is going to explain 70-80%. That makes sense. And the question is, can we optimize that, right? With probiotics and so on. The postbiotic concept, I think it's the absolutely correct concept. It's just that I'm coming again from the microbiome, so I'm not in the regulation. I think what you guys, what the nutrition world means with postbiotics are a little different now than what I understand. For me, a postbiotic is anything that somehow got changed by the gut's microbiota. That makes sense.
That's classic, yeah.
Exactly. But I think the nutrition is that if you actually have a fermentation problem, but it's the same principle. It's again identifying the major metabolites in those. And in the end, I really think we are not almost there. I mean, we need to go more into metabolomics, right? Because at the moment, everybody looks at the sequencing back and forth, but it doesn't necessarily change that there are some metabolites that we may or may not know. And maybe sometimes we have to look outside the guts. And I'll give an example. Like epilepsy, we have now probably 3 or 4 different studies that we looked at epilepsy of dogs. And guess what? In every single study, we didn't find any dysbiosis. Okay. However, you give a fecal transplant to dogs with epilepsy, suddenly you see increases of GABA in the urine. Okay. So there's still something happening that we cannot really measure. So I think we need to expand a little bit of our horizon, and looking at those metabolites also in serum and urine and so on, because they're clearly associated with the microbiome, but it's something that we have to expand and so on.
Wow. And that's a really expensive study, isn't it? So if you want to do the microbiota, the metabolome of the gut and the plasma, serum, whatever, and the urine, suddenly, you go to that with a grant proposal. It's going to go.
It is, but I think, but that's why I think it's what is important. It doesn't have to be in every nutrition study. I think my point is that we need to kind of in research studies try to identify some of those other pathways, if that makes sense. And once you have those, then you can use targeted assays, right? Targeted assays, and it becomes much cheaper. And I think we know, like you like P-cresol, inyxyl sulfate, right? You're coming from the kidney side.
I watch it all the time, right? That's
exactly. But you'd be surprised that we also find them altered in chronic GI disease in cats already. Okay, and again, coming back to this concept, it's all interrelated. So, all coming back to the concept, we don't have to reinvent the wheel in every single study. Why don't we just do targeted assays, and identify what does change those, Because for me, biology is, if you focus on the major pathways, you're going to have a higher success. And so P-cresol, inyxyl sulfate, those are all new markers, but we know they're important, right? And so they can also potentially be part of nutrition studies, right? How do they change, if they change at all, and so on.
Yeah, no, that's fascinating. I can guarantee you, I can change them. It's a question, isn't it? That interplay of all those systems, it's striking, and it's part of the fun.
It is, yeah. But I'm saying we do this a lot now with target assays. So when we started the first metabolomic study, we found like 1,000 metabolites. but really went down the list of the most common pathways. And it started with the bile acid pathway. We still work for 10 years now on it. And the story gets better and better. Suddenly you can clearly identify where normal is, where antiviral is. It's a perfect correlation. If it's there, you have bile acid conversion. It's not there not. So all I'm just saying is sometimes focusing on the major pathways and trying to answer all those questions brings us already a lot forward. If you try to look at everything at the same time, you get lost in the details. So that's kind of my approach at the moment.
Well, you've had great success with it, Dr. Suchodolski.
Yeah, and I think that's why targeted assays is really, really helpful. It takes a lot of this noise out of this big data sets that often are not reproducible. Not by themselves, it's just because the methods, right? You have batch effects and things like that, and that really creates noise. So we need to do the same thing like in kidney disease. You need to have a target assay, and then suddenly you can see what really changes and how much does it change meaningful.
Well, absolutely. And of course, I see this vision that you're speaking of, like you use these type of response variables for a different study. So you may have a fascinating study, right, where you're doing this large amount of analytes in many different places, and you're trying to get that, here's the forest, and then suddenly you start saying, but here's the one analyte or the 5 analytes. Because, when I started in research science, if I knew insulin and growth hormone and lean body mass and blood glucose, and, I had maybe 10. It's like, if I knew them, I thought I had everything. And then suddenly the world blows up and there's so much to measure. So maybe I need to collapse back a little bit.
No, I agree. And I think that is probably also the big difference. That's same thing for me. Right? I'm coming from a diagnostic lab, right? I know how difficult it is to keep one analyte stable for many years. It's not easy. Even very common assays that we measure in clinical practice every day, whose assay vary. And I think, but we also know, like in liver disease, right? If you measure a few enzymes, you can get a good picture where you are, right? If that makes sense, right? And I think the microbiome came from the other side. Suddenly, everything wasn't being able to measure in one big run. And, it became its own field that we have to measure everything in one run and not realizing that in the end, we're actually having quite a lot of noise because of batch effects and things like that. So I think that is really, a challenge. And for example, when you read papers in the microbiome space, there's no validation. Nobody ever showed how reproducibility, right? Nobody actually uses qPCR or anything else to validate your findings. In any other fields, you need to actually show with ELISA or with something, whatever your marker is, that actually is the same, right? It doesn't exist in the microbiome space. And I think that is creates a lot of noise. So it's a great discovery tool. And in the end, you probably need to have both new discovery. But if you afterwards have an assay that you can compare across many, many, many studies, you'll be surprised how actually reproducible it is. And you can really find the big picture and the major players. And so I think that is what we need to probably move forward.
Really fascinating. Thank you. I have a couple other questions I hope you have time to sort of kick around with me. One is just in general, you've been very successful and your lab has been successful. I think I would like to hear, and many listeners might like to hear, what you look for in individuals and say, this is someone I'd like to work with, maybe someone I'd like on my team. What do you do to sort of evaluate that?
Honestly, I can be actually making fun about me because I usually, when somebody comes to me and they say, I'm interested, I'm curious, that's almost like okay, you can work for me. Many other colleagues have this huge interview. Exactly, have interviews and so on. But I think it's curiosity. It's curiosity, but it's also like in our lab, we work so many different projects all over. We collaborate with everybody in the world, and that's really useful for us because we learn the perspectives. That's important. Perspective all the way from a nutrition study all the way to an antibiotic study. You can kind of get the feeling what's the magnitude of a change and so on. And so I want people who are really enthusiastic, they're curious, and they're not afraid to help with many different projects. And it's not sure many can do that. Some students cannot do that. They are kind of overwhelmed a little bit with too many projects and so on. But we have also a very big infrastructure. Our lab is now 8 faculties. We have a huge component. So we have a big support team too. That also helps. So it's not like everybody finds their own niche in our lab, and that's great. Another thing, we have now 2 pathologists, we have internal medicine specialists, we have nutritionists, we have microbiome people. So just bouncing all of this off each other helps a lot because everybody comes from a different perspective, right? And we kind of expanding our own horizon. And so working in a big network really helps a lot. I think that is a thing that helped me a lot. And being collaborative, that's awesome.
Thank you for that. And that sure makes sense. If that's how you succeed, how would you fail in your system? What's the way that just says, no, this isn't working? Is that something you can talk about?
Well, I think we have many students who went through our lab. If that's what the question is about how some students succeed. Most of our students succeeded. A few did not, but they had they wanted to get lost in the detail. I think coming back to the detail, if you get lost in the detail, then you fail in the system, I believe, because not really failing. I mean, you're still going to have a decent career.
Yeah, you get a degree. No, I understand.
Exactly. But I think getting lost in the detail is important, but I think you need to learn to look at the both picture. And so there are we have some people who just get lost in the detail and they're afraid that, oh my God, I'm making a mistake, right? I don't see the big picture. And in every new field, you just have to be sometimes, if all the data matches, right? Sometimes you're going to make mistakes. Sometimes maybe make the wrong conclusion. But hopefully it's really just 10% of it. It's not completely wrong, right? But sometimes you're going to find something. And a good example was with the dysbiosis index, I must tell you, because in the beginning, I was surprised too, because it's in the head that every dog has dysbiosis when you have chronic GI disease, right? But it's not the case. We know now it's very clearly, we can show this with sequencing and so on. And the second thing is why did it resolve? It's dysbiosis. Should you treat it and it should come back, right? So it doesn't mean that I was wrong. My expectations was a little bit wrong, if that makes sense, right? But the good news is, if you're open enough, take a step back, look at that data all together, then you're realizing the data is still correct, right? It was just my interpretation, actually not in mine. It's the field, like antibiotics, right? And I was saying, like antibiotics, a beautiful example. And so you just have to say, oh, wow, it makes sense. And you look at it from different angles. I'm not relying on one single study. I'm relying on a lot of different things that happen around us, right? And some of them may not be published yet, or it's like this. But it's as wealth. And you have to just be sometimes saying, admit, the data is correct. It doesn't mean the data is wrong. It's just the way we made our expectations was wrong. And that is kind of need to be able to change. And then it's not a problem.
Oh, it's so fascinating. I wish I could remember the quote. Some Nobel laureate said, the way to advance is by ignoring some details. And that you gotta see that definite large picture somehow.
Yeah, you have to observe a lot of different things, and they're slowly going to come together. And also being patient, because it also takes a long time to see that everything comes together. But now we're seeing it slowly coming together. And again, also not being afraid is to say, well, sorry, we're never going to be good predictors for GI disease, if that makes sense, right? Because it's an overlapping system, it's a complex system, and so on. But it's also not so complex that you should not use it, right? But it's still helpful to look at it this way, accept it, if that makes sense.
No, it does make sense. So knowing the space that you're trying to dwell in, that you're not saying, I have all the answers, but I have these specific facets that I can watch and they're of benefit.
Exactly. Absolutely.
Well, what do you think if you had someone out there and said, I would like to read more about this. I don't know how many publications a year, Dr. Suchodolski. I get lost. I'm not reading everything that you are an author on. I try and watch your work, but what would you say? Someone saying, I'd like to read more about this. What would you recommend?
Well, the truth of the matter is, I'll be honest, that at the moment, not one single paper kind of would be able to summarize this. And again, this is exactly where I come from, is that we are now there with things come together. I think, I speak a lot with clinicians, for example. I work a lot with clinicians, right? And so we see how does fit what we're doing now really also in the clinical expectation. So we're not independent of that. And now I think we have a nice framework. We have also the same framework with some people who really look into this and say, we need to also change GI disease classifications, right? This classical food responsive, antibiotic responsive, cell responsive. It's like a drawer that is wrong, right? So I think now it comes together, and I think now over the next, hopefully 6 months, 1 year, we can feel much stronger to write review articles, okay? That can actually say exactly. That actually can say why this comes together. That makes sense. So again, that's what I'm saying before. You have to be patient and not afraid to still put information out there, kind of lecture a little bit, even if the story is not, it comes together, if that makes sense. And so you're going to watch for those. The other thing is probably there's plenty of, microbiome forums, webinars available, and so on. We're going to have, in the fall, we have one, and what we try to do is really also bring clinicians into this, right? So, that is a clinical sense of it. And so I think we developed the story, right? And it's going to happen. The story is pretty clear now. We just have to now write everything around it, if that makes sense. And it takes some time.
Well, that's very exciting. I think you're at that space where, so many research scientists would wish to be, where you can start saying, I can pull these threads together to make a very woven fabric. I don't know, maybe my metaphor dies, but it's exciting.
Exactly. No, I'm excited too, and it took 25 years. And and for me, as a final story, that the 5th chapter of my PhD, that was in 2005, never got published. Okay. And here's a funny story, because back then it was, again, we wanted to show how beneficial antibiotics are, right? So we gave beagle dogs Tylosin. And here, look, that's what happens. Bile acids altered into the range where it's abnormal, markers of GI disease went abnormal and so on. And so everybody said it's impossible, because we know that antibiotics do clinically something of a benefit, right? Now, after 20 years, the data is exactly the same what we see now. We see on antibiotics bile acid, this metabolism, things like that. It was just 20 years ago, my mentors had a different expectation. So they were good mentors, don't get me wrong. It wasn't that I had to fight against them, but the whole field had the wrong expectations. And so, but as I said before, the data is always the data. You observe it over time, and you're building a story. And I'm in a lucky position. I mean, I have a great support team here at the GI Lab. I mean, I could never have done it without alone, right? We have a great faculty team. We have this collaborative spirit. We collaborate with many researchers all over the world, so we can have access to samples that nobody else could recreate, if that makes sense, because we're helping them analyzing samples and so on. And, that really helps move the field forward as a big group of people together. But so to finalize it, that's why I'm very confident that the data is correct. We're just improving the story.
Well, the understanding gets deeper and deeper, doesn't it? And to a certain degree, science is a story. When I write a paper anymore, I think, well, what is this story? What is this? The data's still true, but I have to wrap it with some information, or the bones just aren't that interesting. So I understand. Well, this has been very exciting, and I really, really enjoy hearing your expertise and again, thank you for the work you've done. I think you're in a tremendous leadership position in this microbiota area. Many of us follow what's coming out of your laboratory, so it's really excellent. I appreciate it.
Thank you so much. I had fun.